Good afternoon, everybody. Thank you so much for being here with us today and learning about senior services. My name's Katie Earle, and I coordinate our University Express program, and I have the fortunate opportunity of working for senior services. So you are going to hear from a lot of my wonderful colleagues today. And before we get to their presentation, I just quickly want to let you know that during this presentation, if you have any questions or comments at all, type those into your Q&A panel. If you're new to us today, you'll find your Q&A panel located at the lower right-hand side of your screen. If you're on a computer, just click on that, expand it, and send your questions right to me. And if you're on a tablet or smartphone, touch your screen. That brings up your control panel. You may have to click on that button that has 3 dots. Then you should see Q&A, and then you'll be able to participate. So we hope you have some fun with us today because we're always having fun at Senior Services. Now I'm going to toss it over to Maura. She'll start us off. Thanks, Maura. Appreciate everyone being here.
Thank you, Katie. Thank you so much. Hello, everyone, and welcome. Thank you so much for joining us today on this most sunniest of May days. I am Maura Moisio. I am an assistant long-term care coordinator here at Erie County Senior Services. My co-host is Karen Adamo, who you'll see later in this presentation. We are here today with our colleagues from the various units in our department, and will describe what Senior Services does and how you can access services. Okay, so Erie County Senior Services, New York Connects. Here's our commissioner, Dave Schenk. He's our commissioner of Erie County Senior Services and has been since May of 2019. He also serves as the director of the Erie County Veterans Services since February of 2016. Dave's work history includes serving 1 year as Erie County Comptroller and 20 years as Boston Town Clerk. Dave has served in the U.S. Army Reserve since 1988 as a healthcare specialist, also known as medic. His deployments include Desert Storm, Oman, 1990 to 1991, Iraqi Freedom, Iraq, 2003, Enduring Freedom, Afghanistan, 2010 to 2011, and Enduring Freedom, Kuwait, 2013 to 2014. He is the detachment sergeant in the 7207 Medical Support Unit based in Webster, New York. David earned a bachelor's degree in management from Houghton College and a master's degree in health administration from Roberts Wesleyan College. His accomplishments include Erie Community College Distinguished Alumni 2017, Erie County Town Clerk of the Year 2012, Business First under 40 2009, Bronze Star, Combat Action Badge, and Meritorious Service Medal. His wife Polly and him reside in Boston with their 2 dogs, Caesar and Finley. He has a couple comments here. He says, currently I take pride in the continued development of University Express, the start of drive-through frozen meal program, combat social isolation webpage, RSVP volunteers and staff have coordinated over 10 pop-up COVID-19 vaccination clinics, and the New York Connect staff continues to contact homebound seniors to help them get vaccinated. So a little bit about our history. The department is in its 50th year. The department was first called the Office for the Aging and was established in 1971. And it was created because there was a perceived shortage of beds in area long-term care facilities. But upon closer inspection, it was revealed that folks were being put into facilities because they didn't have the supportive services in the community to allow them to maintain themselves independently. Just as an aside, Erie County is celebrating its bicentennial this year. On April 2nd, 1821, New York State officially recognized Erie County. And from the 2010 census, just some demographics. 21.5% of the population of Erie County is 60 years and older. 8.1% of the resident population is 75 years or older. Erie County's 60-plus year population has grown from 14.5% of the total county population in 1970 to 21.5% in 2010. So we're going to dive into the first part of this session, which is, what does senior services do? Well, having worked here for 20 plus years, I can tell you the department does a lot more than I've ever imagined. Here are the various units within the department. There's information and referral, which is an umbrella for several different units, which include case management, New York Connects, Insurance Resource Center, and Caregiver Services. There's also the Wellness and Nutrition Unit, Transportation, RSVP, and those acronyms, we're acronym heavy here in Senior Services. That acronym means Retired Senior Volunteer Program, the Fiscal Unit, and Program Development and Evaluation. And we plan to give you an overview of each of these units today. So the first one that we're going to talk about is case management. And here's some nice pictures, help and assistance for seniors and those who care for them. So you might wonder, what does case management do? What is case management, right? Well, in a nutshell, case management is a process that helps older people and their caregivers gain access to and coordinate appropriate services, benefits, and entitlements. The idea is to help people stay independent in their own homes for as long as possible. Case managers assess folks for services. We typically visit seniors ages 60 and over in their home, but due to COVID-19, we are doing telephone calls to help them and their families assess their situation and determine what services and programs might be available to help. Case managers can help clients. We call people who we work with clients. And caregivers apply for benefits and community-based services that they need to remain as independent as possible. Then, based on a person-centered approach, which considers their needs, strengths, supports, finances, and preferences, case managers will work with clients to link them to programs and services. Some services are at no cost, and others may be on a sliding scale, depending on what a person's monthly income and resources are. There's opportunities to make a voluntary donation to the programs. And once a person begins receiving one of these services, the case manager stays involved and periodically contacts the client, staying in touch to make sure there's no issues and to help work out issues when they arise, or if they arise. And on this slide, you'll see a listing of some of the various service options that we have: home care, home delivered meals, social adult day program, personal emergency response systems, those are those buttons in case you fall, assistance in applying for different benefits like SNAP and HEAP, and then linkages to community resources, for instance, counseling. So Erie County Senior Services, we employ approximately 40 case managers system-wide. We contract with 6 community agencies that have case managers that provide services to a generalized geographic area. So for instance, South Buffalo Community Association provides case management to South Buffalo, Lackawanna, Blaisdell, and parts of West Seneca. Harmonia, which is formerly known as Community Concern, covers Hamburg, Derby, Lakeview, and Springville. Then we have 5 in-house case managers that cover the outlying areas. And those locations that each of those agencies covers, it's not set in stone. So there's blurred divisions between them. So now I'm going to hand it over to Rachel Vega, who heads up our New York Connects unit as the Aging and Disabilities Resource Center representative. And she's going to give us a description of what happens when you call our office. Is Rachel here?
She's here. I just unmuted you, Rachel, but we can't hear you.
What about now?
Now is perfect.
Now it's good. I'm sorry. I apologize. Okay. Well, thank you for having me.
Yes.
Here we go. On New York Connects, we are the call center for the department. We take all phone calls that come into the department for people of all ages, any disability, and their caregivers. New York Connects can work with anyone who needs information regarding long-term care services and supports, children or adults with disabilities, older adults, family members, and caregivers, friends or neighbors, veterans, and any professionals that are assisting persons who are disabled or in need of assistance to seek out long-term care services. And when you call our call center, you're generally greeted by a seasoned case manager who will talk you through your options based on what it is you're identifying as a need, okay? We can help you find care and support, and generally we get through the conversation. We like to talk directly with the individual in need. If not, we will talk with a caregiver who has a demonstrated need and is maybe perhaps seeking out some information. We try to help you understand your care options. We try to help you find whatever that need may be, whether it be transportation, any kind of supported programs, information regarding whatever it is that the individual needs to remain independent in their home. We are the folks that would link you to case management services as performed by other case managers in the community. And if it's not case management services, it's whatever services or options that might be appropriate for your situation. You can reach us by calling 858-8526. We also assist persons with obtaining benefits and entitlements, whether that be SNAP, HEAP, Medicare Savings Program, Medicaid, and any other entitlement benefits that you may need help with an application process for. Once again, our number is 858-8526. And that is all I have.
Great, thank
Next
you so much,
up.
Rachel. Appreciate it. Now I'm going to send it over to Bill Daniels. He is the coordinator of insurance outreach, and he is in charge of our HICAP office. Bill, what does HICAP stand for?
HICAP stands for Health Insurance, Information, and Counseling Assistance Program. It's a big, long word for basically, hey, you have trouble understanding your insurance, give me a call. A lot of people I deal with are underinsured, and they don't realize it. And they might call me when all of a sudden they have huge medical bills. Realize that the number one reason why people are in bankruptcy in the United States is due to medical expenses. So they look at the plan, at the premium, and they don't realize the shortfalls of it. Or get people that have no insurance whatsoever. They might be over 65, but they've never worked and have access above the Medicaid level, and we try to get them health insurance. So we run to different kinds. A lot of people are just eligible for Medicare, and they're overwhelmed by all the options. And since some people are not eligible for Medicare, I want to get them coverage. the Medicare Advantage are the ones advertised extensively in this area, but they're not for everybody. You have to realize the importance of looking at everybody's situation as being different from everybody else. We look at the person as an individual and we try to show them their options. But it's a taxpayer supported service, so we do not sell insurance at all. I will give you your options and help you decide what's better for you, but I will not make the decision for you. Right now, we're not doing one-on-one in person, but we are doing it on the phone. And I've been doing some Zoom meetings with different community agencies, such as Williamsville or Kenton. We also do a long-term care insurance. Long-term care insurance has gotten pretty expensive lately. So a lot of people cannot afford it. And also long-term care insurance, you have to be healthy to buy it. But we look at other ways of paying for long-term care. But it's just so many options out there that people get overwhelmed or they buy the wrong one. That's what it boils down to. So we provide linkage we provide linkage to different programs that could help pay for prescriptions. Epic elderly pharmaceutical insurance coverage. We deal with outreach worker there and with different manufacturers programs that can provide help paying for medicine. So that's in a nutshell. Get people transitioning into Medicare, people that have lost their Medicare because they didn't pay the Part B premium. We do a lot of things to help make it affordable, healthcare affordable for people.
Okay, great. Thanks a lot, Bill. Appreciate it.
Welcome.
Okay, we're going to switch it over to Julie Budd. She's a case manager within our department, and she's going to talk about Caregiver Services and ADCSI, yet another acronym.
Thanks, Maura. So I am a case manager for Erie County Senior Services, but my specific program is a grant that is designed to actually help our caregivers, anyone that is caring for someone with some sort of memory loss. It does not have to be Alzheimer's disease. It can be mild dementia. It can be a little bit of forgetfulness. It can be Parkinson's with dementia. So any sort of memory loss. If you have a caregiver or you are a caregiver for this person, chances are you need respite or a little bit of a break from your caregiving. So this grant was put in place across 7 different counties in the area, and it's meant to give the caregiver a bit of a break so that they can go about their own life. Because what's happening is actually our caregivers are sometimes the only person caring for their loved one, and it can get very overwhelming, and our caregivers get burned out. And then if something happens to this one caregiver that is actually the person in charge, everything sort of falls apart. And that's a problem a lot of times with, more placement situations that end up coming up when they don't necessarily need to. So my job is to use this grant that I work on to help provide this respite for our caregivers. Most of the services that I have are still available right now. I do put in home care sometimes in the form of an aide in the home from an agency, or I also help with what's called consumer direct home care. And this is where someone is hired to help care for your loved one and again, provide you that break that you might need. There is also funding to help pay for adult day programs for seniors. So if your senior is still pretty active and wants to get out a little bit, I can link them up with an adult day program when they are open and have availability. And then my grant would cover the bill of the cost of that program for a short time frame. I like to tell my clients that I'm kind of the trial run person. So if you're not sure that your mom would accept, an aide in the home to help her with bathing, we can try it for free through my program. And then generally I link my clients up with a long-term case manager like Maura had discussed to sort of help with those services on a long-term basis. Other things that my program helps with are I can link our caregivers up with counseling. We do 6 sessions through Jewish Family Services. I also have safety devices like door alarms and night lights for folks that maybe live alone or need that little extra support. And those are both free. And we do care consultations. I link folks up a lot of times with the Alzheimer's Association. Again, they help us facilitate our grant. So they're there in case you maybe need a little bit more information about the disease that you're facing, or you're dealing with some behavioral issues. Sometimes I can help with that just from speaking to lots of other caregivers. Sometimes we pull in the Alzheimer's Association to kind of give some more information. And then they can also link you up with their individual support groups that may be tailored to your specific needs. So generally what happens is folks usually call into New York Connects. Rachel and her team kind of divvy up the people that, that they have to see if there's a caregiver involved. And if there is a caregiver involved and there's some memory loss, then the caregiver comes my way. And then I work with them throughout the course of the whole time that you are caregiving. So I actually have people that I've had part of my program since 2016, and I don't close them out unless we don't talk for a couple years, or other options come up and you make other arrangements. But my program is there, and as long as I have money in this grant, I'm happy to spend it on anyone that could use the break. So always calling into New York Connects is the best way to start that process. And I think that's it.
All right. Thank you so much, Julie. Appreciate it. Okay. So next up, we have Betsy Anderson from our Nutrition and Wellness Unit. She's a dietitian consultant, and she's going to talk about all the wonderful things that their unit puts together.
Thank you, Maura. And as Maura mentioned, I'm a dietitian with the Nutrition and Wellness, and I'm going to share some slides from our Assistant Project Director, James Struzinski. And the first of our programs I'd like to tell you about is our Congregate Stay Fit Dining program. Throughout Erie County, we have 48 dining programs. These are at senior centers, community centers, and senior housing facilities. And each month we bring nutrition education topics, as well as we offer nutrition counseling that's free if anybody's interested. We have throughout Erie County over 3,000 registered participants. And just as an example, in 2018 served over 240,000 meals. So many seniors are coming to enjoy the nutritious, balanced lunches, and we hope that we'll see you at our lunch. The suggested confidential contribution as able is $3. And also, I wanted to mention, in addition to our congregate dining, Stay Fit Dining, we have the frozen meals program. I know, Maura, you mentioned that in the beginning. That's a wonderful program. It's a curbside pickup. And if anyone is interested in that, to please call our office to get registered, and we'll love to service you through that program as well. And on our next slide, one of our activities too, as you see, Club 99, helping everyone stay fit and happy, and exercise groups that take place at a number of our senior centers. As you can see, these are very popular group, and we really like to have seniors enjoy being physically active, and they're very motivated in their activity. So we hope you think about joining our Club 99 as well. Another program on the next slide that we have at our senior centers, which is really popular, is our healthy cooking demonstrations. And we teach simple, healthy cooking techniques that seniors can follow and use at home. Along with the cooking demonstration, you get great recipes, and you also have a sample. And it's always a really fun, popular presentation. So we'll look forward to having those going and seeing you there. On the next slide, our University Express. Thank you, Katie, for having this all organized with lifelong learning for adults in Erie County, and the magazine that comes out in the spring and the fall semesters lists the wide variety of topics that you can enjoy listening in on topics and learning new things. So we really are fortunate to have that University Express program. Another program on our next slide is our Matter of Balance. And again, this is done at the senior centers, Also during this time, it's been provided through a virtual, while some of the centers weren't having it in person. But the Matter of Balance is a wonderful program, strengthening and balance, practicing exercises, all to help with preventing falls. Such an important type of exercise and practicing. You get a really good foundation on very good activities to keep you safe. So that's a very popular program too, the Matter of Balance. On our next slide, we have the Aging Mastery Program. This is in cooperation with the National Council on Aging, and it's a program designed to help empower and support people in being healthy. It teaches information on nutrition and activity. It includes information on financial security and overall well-being. And over the 10-week program, there are speakers that come in to present topics who are really experts in their field. There's a lot of support amongst the participants in the program. People stay very socially connected, work on healthy habits, healthy eating, physical activity, learn about advanced care planning, and overall healthy behavior. So it's a very, very enjoyed program by the participants. I think people really build a lot of support between each other as well. The next slide talks about another program that we offer, Choose Healthy Western New York and Choose Healthy with Diabetes. These are 6-week programs, and through participation, so many skills, new information, and reinforcing of healthy habits for individuals in the workshop related to nutrition, physical activity, things like communicating with your healthcare provider, learning skills that are so helpful in everyday making decision making. And each week, participants in the program set action plans, and by being part of a group and having a plan, it really helps motivate people in things that they're choosing to work on in terms of helping their health or whatever particular goal they set. And as you can see on the slide, for people that are interested in our classes, they would call my coworker Janice, and her phone number 858-7470. These workshops get scheduled through the year, and there's also telephonic versions too. And on our next slide, one of our fun projects, activities in the summer, we have a summer picnic. And as you can see, seniors always really enjoy being able to get together and be able to enjoy socialization and a fun picnic and a fun day. So we have so many fun events going on. And there's another slide following this to talk about one of our other pilot programs too that's really been well received and well attended, our Go Dine program. And this was started under a grant between Erie and Albany counties. The restaurants that participate, there's certain items on the menu that are part of the menu that seniors who are registered with the Go and Dine program, when they go to a restaurant, they'll have a coupon to be able to enjoy during that month 4 meals a month. And the restaurants are throughout Erie County, working on trying to reach out to neighborhoods where perhaps the senior center isn't close by, or also reaching seniors who, because of other activities in their schedule, may not always be able to come to the dining programs. But the restaurants are really enjoyed by the seniors. Again, to call Erie County if you're interested in signing up for that program. And so on the next slide, just as a reminder, we will hope that you come and join us for some of our nutrition and wellness programs, the meals and fun activities, because we'll be very happy to have you be part of our program. And finally, we just want to thank you for letting us share our information, and we'll look forward to seeing you. Thank you so much.
Thank you, Betsy. Appreciate it. So now I'm going to turn it over to my co-host, who is a senior case manager here in Senior Services. Her name is Karen Adamo. Take it away, Karen. All right.
Hi, everyone. Welcome. And thank you, Laura. So I'm going to start with our unit, which is transportation. And as a service to older adults, again, age 60 and older in Erie County, it's in collaboration with community partners. The Department of Senior Services offers the Going Places Transportation Program. This is a curb-to-curb van service, and it's available to seniors who are unable to use conventional means of transportation. So you can call to register at 858-8526 or 858-7433. And now I would like to introduce you to our outreach aide, Kitty Torino. She works in our RSVP program.
Hello, everyone. I'm Kitty. Can everybody hear me?
Yep.
Yes.
I'm with RSVP, and it is a program to inspire seniors to volunteer in our community. As mentioned earlier, it stands for Retired or Senior Volunteer Program, so RSVP. And we like to say, your invitation to serve. So what we do in our department is connect seniors in Erie County to a full range of volunteer opportunities. We work with over 90 local nonprofit and public organizations who are reaching out to us and asking us to provide volunteers to their organization. We have a YouTube link here if you wanted to click on. When the presentation is over, you'll get a good 30-second explanation of the program. On our next slide, we have one of our volunteers. He works for Rural Transit, and actually, Chuck, he's been with us for a very long time. He has received the Presidential Service Award for all the hours he has put in as an RSVP volunteer. So if you're looking for an activity that is scientifically proven to help you live longer, report less disability, and experience higher levels of well-being, and having the added benefit of helping others, we have the answer for you. It is to become an RSVP volunteer. I mean, what could be better? Healthier lifestyle, less social isolation, living longer, and you're helping others. That's the kind of program that we run and the opportunity that we could get you involved with. And the next slide. This is a group of our volunteers who helped out recently at one of the vaccine clinics. As mentioned earlier, Erie County Senior Services helped a local Rite Aid branches to distribute the COVID-19 vaccine to seniors in Erie County. And we did this through our senior centers. So we do partner a lot with the senior centers, just like Nutrition and Wellness does. We partnered with local senior centers, and we actually administered about 1,400 COVID-19 vaccines to the older population in Erie County. And these are some of our volunteers that helped out with that. And they're in the photo here with the pharmacists from Rite Aid. So you can make a difference, not only in your own life, but in your community and the lives of others. RSVP works to place older Americans and by older, 55 plus. To me, that seems young, but we place older Americans in volunteer roles that fit their schedule, their interests, and their talents. Next slide. We have, this is one of my favorite photos from RSVP because, you know, you can choose what organization you want to work with. You can let us know what your interests are. Maybe you were an RN for your career, but now you wanted to spend some time with the animals at the Buffalo Zoo and the children that come to visit. So that could be your vocation after your career. You want to volunteer at the zoo. We can open that door for you. We kind of do the leg work. We get you connected. You start volunteering there, and it will be an enjoyable experience for all. So our volunteers do everything from delivering meals to homebound seniors. That would be with Meals on Wheels, Feed More, Erie County. They also read in school to primary school children. They serve as docents, not only at the zoo, but the Naval Park or the Martin House. And we have seniors that even help build homes with Habitat for Humanity. So there's a wide variety of opportunity. And if you contact RSVP in Senior Services, we can point you in the right direction. On our next slide, the reason we do this is, again, to help battle certain elements of senior life. We want to keep our seniors healthy and active. So our volunteers are part of a national conversation about the positive impact of older Americans on our communities. As a volunteer, you build new friendships, you learn about your community, you have meaningful reasons to get up and get out and get going in the morning. Being a volunteer, as I mentioned earlier, helps fight that social isolation that seniors may feel. So whether you're looking for a one-time volunteer opportunity or a long-term commitment, give us a call and we can open some doors for you and get you set with a local organization. I want to add here that when I say we're part of a national conversation, RSVP is actually a branch of AmeriCorps Senior, which is part of AmeriCorps. So we are part of a national program with thousands of volunteers working under the label of RSVP throughout the nation. But I'd also add that here in Erie County, we are the largest volunteer group in the nation. We have 900 volunteers. And of course, Erie County, Western New York, we're friendly people. We like to help. And we're really telling that story on a national level through our program here at RSVP Erie County. And then on the final slide, I think it's the final one. So people can volunteer anywhere they'd like, right? You don't have to be a member of RSVP. But if you want to volunteer through our program and be part of that national conversation, we do give you a few benefits to do so. You do receive a modest reimbursement for travel to and from your volunteer site. This is given quarterly, and that's up to the volunteer. You don't have to accept that mileage reimbursement, or you can accept it. It's really up to you. Some people accept it and then donate it to charity. We also offer supplemental insurance while on duty, and this is an auto insurance. Think of it as an umbrella policy. So driving to and from your site, we just give you a little more coverage with an umbrella policy. And that's because we value our volunteers and the services they provide. We also celebrate our volunteers. We have an annual tribute day, and this is a great event. Everyone looks forward to it. We invite the volunteers who have served 40 hours or more in the year, and it's a free event with food, music, entertainment, and transportation if needed. Last year we did a virtual tribute day, but even that was really great fun. So, and then we award our most valuable volunteers with a Volunteer of the Year award. And each year we have at least 4 to 6 RSVP volunteers who qualify for the Presidential Service Award. And this is a great honor. It's for 4,000 hours of combined service. And you get a great plaque, which is signed by the administration, the president. And there's a luncheon where you invite your family, and it's just a really nice event. The final slide is just contact information. You can visit our website at erie.gov/RSVP. You can call me, Kitty, at 858-7548. Or our email, which is real simple, rsvp@erie.gov. You can also find enrollment forms here and an orientation schedule. So get involved and join RSVP today. Your invitation to serve.
Awesome. Thank you so much, Kitty. Now I would like to talk about our fiscal unit, moving on to more of our units. And in our fiscal unit, they do a lot there. They are very busy. They prepare and monitor the department's county and grantor budgets. They prepare reimbursement claims for federal, state, and private foundations grants. They process vendor payments, revenue receipts, and interdepartmental billings. They compile fiscal data for state quarterly reporting. In our 2021 adopted county budget, it totals $19.1 million. 95% of that, which comprises of our 20 different grant programs that they deal with on an annual basis. So they are, like I said, a very busy unit, and they do a great job keeping our unit and services funded so that we can keep assisting the residents of Erie County. And next, I want to introduce our PD&E unit. PD&E stands for Program Development and Evaluation. PD&E works on program development, contracting, program evaluation, needs assessment and planning, and community engagement. So starting with program development, under program development, PD&E works on addressing gaps in the service system. They secure new grants for us. They build new community partnerships. And then under contracting, they monitor both direct and contracted services for reporting and compliance. Under their program evaluation, this is where they work on improvements and adjustments to services where they're made and they're based on data collected from client satisfaction surveys. They also review performance on plan goals. Under needs assessment and planning, PD&E is a 4-year plan designed to, the needs assessment and planning rather, is a 4-year plan designed to address needs to, our little box is in the way of what I'm reading here. This plan is updated annually. The needs assessment and planning is updated annually. And it's all designed for our senior population in Erie County. Under in community engagement, PD&E performs outreach and education and advocacy. They coordinate with community partners and maintains an advisory board. If you are interested in becoming a member of our Senior Services Advisory Board, please contact Christy McKenzie at christine.mckenzie@erie.gov, or you can just simply call our main number at 858-8526. So again, this certainly shows how vital our PD&E program is, and they do a really great job as well. So this completes all of our units. And you might be saying, so what did you say again? Because we've said so much. So we just want to just highlight some of our units. We're not going to cover everything again in this segment, but just some highlights. So we talked about dining sites and home delivered meals. We can help with transportation. We can help with home care, social adult care, social adult daycare, socialization opportunities, dining. Rachel talked on our New York Connects and our volunteer opportunities with Kitty, Caregiver Services with Julie, and our insurance resource program with Bill. Thank you to all of our speakers. We really appreciate it, and we all really work good together and hard for our Erie County residents. We also covered case management and linkage to services. If there is something that hasn't been covered or that you are still looking for, please feel free to call us. Again, our main number, 858-8526. And we would also like to remind you that you can access this presentation with all of our contact information by visiting our University Express website. And that'll be talked about more later in the presentation. Here is our Erie County Senior Services website. It's pretty comprehensive in terms of information that is available. We also try to update it as soon as things change. And we'd like to give you our main number again, one call for really all of your needs or questions, 858-8526. No matter what you are calling about, you can start by calling our main number, and we can assist or direct you to, or direct whatever your needs are to someone who can assist you. And Erie County Senior Services, we're located downtown in the County Rath Building, and we're located at 95 Franklin Street on the 13th floor, Buffalo, New York, 14202. We want to thank you for taking the time out of your day for us to showcase our department to you, and hope you can benefit from us at some point, whether it be big or small. We look forward to servicing you. Now I'll be turning the presentation over to Katie Earl, who is our coordinator of volunteer training and development, and she will monitor our question and answer time. Thank you.
Thank you, Karen, and thank you to all of you for taking time out of your day and talking about what you do and how you serve the people in our county. So I really appreciate you. And everyone who's on, we really hope you take advantage of our services. So we do have quite a few questions here. And the first one is, are Club 99 and the Matter of Balance and Aging Mastery programs available at the Amherst Senior Center? If I may, I will take this one because I gave Julie Rosala, who's the coordinator of our Club 99 program, a quick call, and she said not currently at Amherst right now, but if this person or anybody else wants to get on a list to be notified when programs are starting up, you can give her a call, and her phone number is 858-6403. That's Julie Rosala, 858-6403. So the next question we have here is, please tell me more about how somebody qualifies for the transportation services and what kind of transportation is this? Only to and from doctor visits or other kinds of transportation? So whoever wants to answer that, go and unmute yourself, please.
Okay, Katie, I can take that. Can you hear me okay?
Yeah, you sound great.
Okay, great. So yes, in our transportation service, there is a brief registration process. It consists of a form that if you call our department, call transportation at 858-7433 or our main number anytime, and we can connect you to them, 858-8526. We can get you over to transportation. So you will need to just call and get that registration mailed to you. So if you feel like you need a ride, better to try to get in touch with us as soon as possible so you can get that mailed to you and you have time to fill it out and mail it back. It's a one-page application where you just fill out the front and then you sign it on the back, so it's very short. Once we receive it, you'll be part of you'll be registered then, and then you can call and make appointments for rides. There is a suggested contribution of $3 per one-way trip or $6 round trip. If you use a wheelchair, it would be $8 one way and $16 round trip. Contributions, again, this is a contribution, so they are voluntary and always confidential, and no one will be denied services if unable to donate. They do prioritize their van rides in case they get really busy, so they start with the health-related transportation needs first, and which of course are non-emergency rides. So there would be trips to the doctor, for example, or trips to a clinic or hospitals for procedures, counseling sessions, therapies, and prescriptions to get prescriptions. Then food and nutrition. There would be rides for trips to Stay Fit dining sites, for example, or grocery stores. And then they go down to personal business trips for like banking or bill paying, applying for services such as heat or going to social service buildings, or to even visit our high cap office here in the Rath building for the healthcare counseling, and or if you need rides for legal assistance for anything. So that's kind of how they go through and make appointments. So if you're scheduling for something that's health related, they really ask for you to call 2 weeks in advance. Once you're registered, don't forget to register first. Call 2 weeks in advance to make that a health related appointment. And if it's non-medical, you can call 1 week in advance. So you can call us or check out our website for a listing of other local community agencies that provide van services as well. So we can help you with that too.
Thanks, Karen.
You're welcome.
There's another question about vans too, and this is a good one. Is the curb-to-curb van service available to seasonal residents of Erie County or only permanent residents?
Well, Scott directs he's our director of our transportation unit. But if you're registered, I think that's the key, just to be registered. And then we should be able to, to accommodate you when you're in town, as long as you're within Erie County while you're here.
Okay, thank you.
You're welcome.
The next question we have is, does the county senior services offer any type of care management or advice? So maybe we could talk a little bit more about New York Connects and then the case management handoff.
Katie, can you repeat the question one more time, just so we know who should talk first?
Yep, it's, does county senior services offer any type of care management or advice?
Care management, okay. Yeah, I think when you first call our department, 858-8526, or our New York Connects 1-800 number, when you reach, like Rachel said, you'll get a seasoned case manager, and when you start talking, we'll understand what you're asking, and if not, we'll ask you questions, and we'll get to the bottom of why you're calling. And then yes, we definitely we do what we call options counseling, and then if needed, we can do a referral to our case management department to do a whole assessment. So I don't know if Rachel, did you want to add anything to that? Rachel heads up our New York Connects, and that's where the call will originate in.
Rachel, I'll unmute you. Oh, there you go. Go
okay. Or as Julie described, if it is a caregiver issue or care management, or you're trying to try to get through a care plan for a loved one, I mean, those are services that we can, obviously we would to start that discussion. Part of New York Connect starts you off with what's called options counseling. That options counseling, I didn't elaborate, can occur due to COVID. We did put on pause a face-to-face meeting, and yes, we do things telephonically as a rule because we're taking those phone calls in, but we are able to go out and meet you in the field, face-to-face, wherever you might be or wherever you might find it easier, more accommodating, if it needs to be with family members, to present the information about all services so that everyone's receiving the same information at the same time, so that there isn't a person from the family funneling this information, not necessarily as a mediator, but as we do in HICAP, we provide non-biased information. And so the family can, as a group, come to a decision. So we just provide you with the facts and the information around any of your questions, and then you, at some point in the future, can make arrangements and circle back to us with what it is you're going to finally decide to do. And if we are able to take it further, we will do that by assigning yet another link to the puzzle, which would be either our case management services in-house or case management services with a partnering agency. I hope that answers your question.
I think that that's great. Thank you all for that. The next question I'm seeing is, how can I get connected with nutrition counseling? Betsy, I'll unmute you. Go for it.
You can, the person interested in nutrition counseling, if they go to one of the senior centers, they can always ask the site manager to pass their name to us. We come out to each of the centers. If it's someone who isn't currently going to the center but would like to call, you can telephone to our New York Connects number, the 858-8526, and they'll send you down to us. And then we can talk, find out what information would be helpful. So either by calling or letting one of the site managers. Also, I'd really encourage, when you are at the program or signing up for one of the programs, with our registration sheet, there's a nutrition screen on the bottom of the sheet. There are a number of nutrition questions, and we always make a call to people that have circled a number of the items listed, because we like to follow up if we see someone that might benefit with nutrition information. So we always are happy to provide counseling. Thank you for the question.
Hey, thank you, Betsy. I'm just going to give it a second here to see if anything else pops through. While we're waiting, does anybody have anything they forgot to say or they want people to know about their program? That way it gives folks time to type stuff in.
Oh, Katie, I could add to that nutrition counseling too. If the client is case managed through our department and they are receiving services, if they want and if they're getting Meals on Wheels, then through Feed More of Western New York, so it's called Feed More of Western New York. It used to be referred to as Meals on Wheels. So if they are receiving Meals on Wheels and they're being case managed through us, they will then be referred to Feed More for that nutrition counseling. And then, of course, like Betsy said, if they are in some kind of congregate dining or any services that they provide, they would do the nutrition counseling for those clients. And if you're not affiliated with with our nutrition department nor our case management department, then we would, our New York Connects staff would then tell you to contact your doctor for any type of nutrition counseling.
Okay, awesome. Thank you both. We
Sure.
have another transportation question. This person is wondering, does health-related include rides to the YMCA?
Yes, I would, because that would be for to maintain your health, right? What they would do is like how they tier it, where they take on the medical appointments first, and then yeah, they definitely will try. They make every effort to try to get everyone around to where they want to go. It just may be you may have to wait. They'll let you know the time frame of when they can get you there, and then maybe moving forward, they'll have you call so many weeks in advance for those kind of rides, just so they know that they can accommodate you. And also, we want to also give you Scott's the transportation phone number, which is 858-7433. If you want to call directly, just to double check with your questions, since they weren't a speaker today with us. So he would be really, really great and be able to tell you for sure. But yeah, they will definitely try to accommodate you.
Thanks, Karen. I know we're at time here, so if anybody has to pop off, I completely understand. I'm just seeing one more question that came through. So this is, if a medical service is unavailable in Western New York, can you help arrange for out-of-area care?
Can I say something?
Yeah, yes, thanks, Rachel.
Okay. So if we have, our transportation department would not handle the out-of-area care. If you have an individual or if you or a loved one need to see someone cross-county, that service would need to be provided by another service provider that actually does that. In this case, the option for that type of service would either be one private pay or for a suggested, they do have a fee. The Western New York Independent Living Center offers transportation to all, I don't know how many counties are we, 5 or 7, the 7 counties of Western New York. They cross into Niagara, Chautauqua, Cattaraugus, Allegheny counties. They would do that on a fee basis and then charge per mile. And they can be reached at another number, which would be the 832, and bear with me, I don't have it at the top of my memory bank here. 836-0822 to inquire about what's called the Independence Express. And their hours are more expansive. They operate earlier in the morning. I believe their first start time is at 7 a.m. and they go as late as 10 p.m. Monday through Friday. That is a different type of service, and it is for persons who are also declared disabled. And that number again is 836-0822 for the Western New York Independent Living Center's Independence Express.
All right, thank you, Rachel. Karen, you're leaning in. Did you want to add anything?
No, that was great. Thank you, Rachel.
You're welcome.
It's a different way of interpreting body language virtually, right? Okay, so now I'm seeing thank you all. I'm seeing thank you for everything you do for our community. So to my colleagues who are on, I appreciate you. To everyone who's on, thank you for spending your afternoon with us. I will try to post this on our website in the near future, and I will let you know that Bill Daniels will be back with us for health insurance FAQs on June 28th at 2 p.m. And then we'll have the American Tradition of Volunteering with Alex and Kitty with our RSVP program on June 24th at 2 p.m. So you can register for those on our website. And I'm just seeing a lot more thank yous coming in. So everyone, thank you so much and enjoy the rest of your day.
Thank you.
Bye-bye.